So our topic tonight is sarcoidosis and anxiety, common companions. Really interesting topic. We're looking forward to it. For anybody that's new, just go through a little commercial about the Life and Breath Foundation. My name is Sean Hall. I'm the president and founder of the Life and Breath Foundation. We were established in 1998. Our primary goals for the foundation is to offer the sarcoidosis community effective tools to track their journey, decipher medical issues, and maximize their quality of life. Also, to provide a nurturing environment for those affected by sarcoidosis to share their experiences. We feel instances like tonight, being able to share information, being able to collaborate, so that we can pass on and disseminate the highest level of information by experts, we think is very valuable. By doing that, we hope to build awareness within the medical community that can really help us combat this chronic disease. How we do that, we're a volunteer-led organization. All the money we receive in donations and sponsorships go directly to the patients with sarcoidosis. We're building tools, educational components to be able to help you manage your journey and manage your health. We do that with these monthly speaker series such as tonight. We sponsor and fund a Life and Breath Scholar Program, which is a physician education program geared towards building an awareness of sarcoidosis with some of our residents in the pulmonary field. We hope to bring them on as ambassadors to be able to help combat this as they are running through their residency and ultimately becoming a physician and being able to treat patients. We also have patient support from experts from all around the country that share information with us, best practices. We also receive sponsorships, which we support education. The latest item we have that we are very excited, it is a tool that can help you track your journey, especially if you're newly diagnosed with sarcoidosis. The Life and Breath Planner can be found on our website, www.lifeandbreath.org. It is a tracker that is going to help you manage your healthcare, your prescriptions, your mood swings, your diet, your medications, tracking your appointments between specialists and your primary care physician. But it's going to give it to you in one spot. We can deliver it to you in a paper form, i.e. a booklet, or we can deliver it to you electronically. So please, if you're interested and you need help, we'd like to get that to you. It's just an example of what we do and how we do it for our patients. So our guest speaker tonight is Carl Robbins. Carl is a psychotherapist with nearly 40 years of experience in treating anxiety disorders. He is the director of training at the Anxiety and Stress Disorders Institute of Maryland. And he is a clinical instructor in the Department of Psychiatry at the University of Maryland. One of his sub-specialties is health anxiety. Carl is a fellow traveler. He was diagnosed with sarcoidosis in 1999 and received treatment for over 5 years. He knows firsthand the fear and anxiety that many of us face as we cope with the disease that carries so much uncertainty. The last thing I wanted to share with you before we bring on Carl is an understanding that this webinar is really not dedicated to give medical advice. There's no doctor-patient relationship being established while talking to Carl this evening. Carl does not know your medical background, and therefore he cannot give you any specific medical advice. We encourage you to speak with your doctor before acting upon any information that was shared with you this evening. Without further ado, I'd like to pass things over to Carl Robbins. Carl, good evening and welcome.
Thanks, Sean. I want to begin by thanking you because I will tell you that almost 25 years ago, when I was diagnosed, I think many of us, it was the first time in my life I'd ever heard of sarcoidosis. I didn't know anybody else who had had it. And I must say that finding life and breath and finding a community was really a godsend. And it was just enormously helpful, in addition to everything that you do, just to know that you're not alone in this journey just has meant so much to me over the past quarter century. So thank you.
Thank you for that, Rob. That means a lot. I appreciate you saying that.
Sure. Okay, so I'm going to share my screen. Let's see here. Here we go. Okay. So this is a new topic for me. I have a ton of slides. I'm not going to get through all of them. So I'm going to try and highlight the high points, and I'm also really interested in starting a conversation. There were some great questions that Abigail sent me ahead of time. I'd like to get to at least some of those. But let me just throw out some ideas that might be useful to consider. This is from the Life and Breath website describing sarcoidosis, and right off you can see is that there's so much uncertainty. It can really affect any organ in the body, and certainly more than one organ. That was certainly true for me. There's no known cause for sarcoidosis. We don't know, exactly why we get it. I think that there may be some genetic component, but we really haven't been able to identify a cause. And that in terms of the course of sarcoidosis, that can vary widely. Some people just do watchful waiting. It's a mild case and it goes away within a few years. For other people, it can worsen. And the reality is, and that we know from Sean's mother's experience, is that for a small percentage of people, they can die from it. So there's this huge uncertainty in terms of severity and prognosis. I came up with this very early on. I used to refer to this as the who knows disease, to sort of really highlight that there is so much uncertainty. And, there's a lot of discussion in my field about the role of uncertainty and anxiety, and what exactly is it, and is it a feeling? It's not really a feeling. It is, the best definition is knowing that you don't know something, right? It's that you don't have information to know something for sure, all right? And whenever we're confronted with uncertainty, there's a tendency that we have to imagine our worst fears and into this unknown to sort of project worst case scenarios. And as a result of this mental process, we can end up with lots of anxiety, fear, and even panic. Just part of the uncertainty. I won't go into my own diagnosis story, but I think like many people, I went through months of misdiagnosis, from everything from exercise-induced asthma to maybe lymphoma. And here was one of my favorites, which is that when I actually had a biopsy of a cutaneous granuloma, the doctor actually said to me, "You can't have sarcoidosis because you're white." And all he had to do was, of course, ask me one more question. So, I hope that in the last 25 years, the process of getting accurately diagnosed and more quickly has improved. My own treatment journey, I think I mentioned it in my bio, is that I was on prednisone for 2.5 years. I discontinued it. And then I relapsed. I was on prednisone for another 2.5 years. And thankfully, I've been in remission now for about 18 years. And I continue to be monitored. Since I had cutaneous sarcoid, one of the ways in which I sort of monitor it is to see a dermatologist once or twice a year. And, and that if there's other concerns, I have a pulmonologist and a cardiologist, as many of us do. We have a treatment team as well as my primary care doc. I want to point something out here, which is that the monitoring process is not based on my anxiety, on my fears, on my feared fantasies, right? As I come in, and I think this is a really important point, that to base your healthcare decisions not on how scared you are, but on, as much as you can, a consideration of what's going on, a real world information on what you're experiencing right now, and not based on your imagination. I think it's important to point out, this is certainly true for me. The range of onset for sarcoidosis is between age 20 and age 60. And for many of us, this is really our first direct encounter with our own mortality, right? And that was true for me. And because I recognized that where it could lead. And I think that it's important to be able to find a safe place where you can talk about those fears, right? Without catastrophizing. I've actually done some research on what is the incidence of sarcoidosis and anxiety disorders, and it's actually pretty high. That about a third of us meet criteria for some kind of anxiety disorder, and this is actually almost twice the rate as it is for other general medical conditions. All right, and what do these anxiety disorders include? They include panic disorder. There's a prevalence of at least of more than 6%, which is twice as much as it is in the general population. And maybe we can explore later why there might be a higher incidence of panic disorder in those of us with sarcoid. And another anxiety disorder is generalized anxiety disorder, and you also see OCD. But the most important one that I want to talk about is something called illness anxiety disorder. And fortunately, this has replaced the old term, which was really sort of judgmental and demeaning, which is hypochondriasis. And the important point here is that illness anxiety disorder, being excessively worried about a serious medical illness, is not necessarily incompatible with actually being sick. You can have both. You can have a serious illness and also have what is called illness anxiety disorder. And the idea is that the anxieties and the preoccupations are out of proportion or excessive relative to what we know about the disease. So let's see if we can unpack that a little bit. And this is what makes for the risk of developing illness anxiety disorder. And I know that from some of the questions that we got ahead of time is that some of us, including me, had a history of anxiety and anxiety disorder before we were diagnosed. And of course, that makes us much more susceptible to developing illness anxiety disorder. Here's a really, really important point. When you develop preoccupation and a lot of fear about a real or imagined illness, you can break into two categories. Either it can be the care-seeking type, which is the sort of overuse of the medical system, where there's probably the most important, a good word that I've heard is there's this kind of frantic search for treatments and investigations. There can be doctor shopping, et cetera, right? And again, it's driven by anxiety. On the other hand, this can also break down into the care avoidant type, which is that I'm so afraid of, well, it can be a fear of the procedure itself, like getting a bronchoscopy, or it can be, a fear of getting bad news. And in fact, that can obviously delay treatment, which is really, really unfortunate. And sometimes people oscillate between these two types. All right. So what are the features of illness anxiety disorder? There's repeated worry, this sort of unhelpful, repetitive rumination about being ill and what it means and the prognosis, et cetera, right? That there can be unhelpful, repetitive attempts to gain reassurance from healthcare providers, right? And I want to say something. There's nothing wrong with seeking reassurance. I mean, I can remember in my own journey, there was a moment I had actually seen my ophthalmologist, and he was a really sort of down to earth guy, not at all, the kind of, he was not at all a Pollyanna. But I just remember when I was leaving, he just said something encouraging that, that he thought that I would do well. And it was, I remember that as a real gift. But that's a far cry from sort of repeatedly, seeking some kind of guarantee over and over again that I'm going to be okay, that my worst fears are not going to come true. That actually maintains anxiety. Even though there's an attempt to relieve it short term, it actually worsens the anxiety. All right. There's also, also when you notice that you get really, really anxious just even thinking or talking about it. And particularly that if, here's something to consider, that if you get reassurance and it's not helpful, it's really worthwhile taking a look at, okay, so why is it that I'm not trusting what my pulmonologist or my primary care doctor said to me? And another big one is, and this is where it looks a lot like obsessive compulsive disorder, is repeated checking symptoms. What's the treatment for illness anxiety disorder? I know that's one of the questions, and I would say anxiety disorders in general is cognitive behavior therapy. All right. And this is specifically looking at current ways of thinking and behaving that drive the distress, the anxiety, and the dysfunction. All right. Now, CBT, there's a lot of misunderstanding. This is not about positive thinking, all right, nor is it about thought stopping, nor is it about learning how to relax. That if that's what's sort of presented as the primary interventions, CBT is a sophisticated treatment that fundamentally changes the way in which you think and behave, particularly around being ill. Here's some unhelpful checking behaviors that we see in all health anxiety. And Sean and I were talking about, the wonderful resource of the journal that's available and all the information that's there. And and getting accurate information from one or two sources, right? Not multiple sources. And if I was going to give one piece of advice, it's stay away from Dr. Google. All right. That's a rabbit hole, because inevitably what happens is you get zebras rather than horses. And people end up scaring the hell out of themselves rather than getting useful information. I say this somewhat with tongue in cheek, but I think it's important to to sort of make a commitment to yourself that you're not going to practice medicine without a license, nor are you going to consult with other people that are practicing medicine without a license. All right. And finally, another form is sort of doctor shopping. Again, this sort of frantic sort of searching for answers, for reassurance, for guarantees. Important point I want to make, I'm not a physician, but there is data showing that many of us are on prednisone, and prednisone can have neuropsychiatric effects, including an increase in anxiety and increase in depression. So it's something to watch out for, and certainly can be treated, particularly on, when you start on high dose steroids. I used to joke that when I started on prednisone, I'd wake up at 4 o'clock in the morning and I could either paint a house or eat a horse. And fortunately, as the prednisone was tapered down, a lot of that sort of agitation and speeding up subsided. All right. One of the reasons why we might see a higher incidence of panic disorder and anxiety and disorders in general is because with any lung disease, particularly with sarcoidosis, you can get what's called dyspnea, or a feeling like you're not getting enough air. And at least half of people with sarcoidosis will experience that sensation of not getting enough air. And it can be acute, chronic, or intermittent. Here's the important point. Feeling short of breath or air hunger does not always correlate with having low oxygen, right? It's a physical sensation that may or may not indicate that there is something medically wrong. So it's really important to work with your medical providers to sort of learn that when you are experiencing shortness of breath, how do I decode whether this is a benign symptom or in fact a symptom of anxiety versus a sign that my sarcoidosis is getting worse, and that there's some kind of pending urgent medical problem. All right, because again, I want to emphasize that dyspnea, shortness of breath, is a very common symptom of anxiety and panic. And there's a cycle that I see that, I treated hundreds of people with panic disorder, and this is the typical cycle that people get into, that they feel short of breath and they start worrying that this is a sign that they're not going to be able to get enough air, or they're not breathing, all right? And then as a result, people then overbreathe, they actually hyperventilate, which actually makes the sensations worse. And then that increases the fear, and you can get into this self-amplifying, self-perpetuating cycle that can escalate into what is basically a panic attack. So a panic attack is always the interaction between symptoms and the fear of symptoms that feed on each other. So this is where it's really, really important to work with your medical providers to be able to detect, when this sensation is a serious issue. Okay. And by the way, feeling short of breath is not the same thing as I can't breathe. And of course, that's one of those self-talk items. If you say to yourself, oh my God, I can't breathe, rather than I am short of breath, of course, if you believe that thought, that would make anybody panic. Okay. So this is the kind of thing that we would do, slow down and unpack in cognitive behavior therapy. I did come across a really interesting study on the use of a 20-minute mindful breathing exercise for people with shortness of breath that have lung diseases. And I'm not going to go into it now. I'll make my slides available. Hopefully, Sean, we can make these downloadable. And here's a 20-minute mindful breathing exercise to help you respond to feeling short of breath that does the opposite of escalating you into panic. A little bit more on panic attacks or high anxiety, right? The reality is, for those of us that are prone to anxiety, right, is that we can have very, very active imaginations. We can play scary movies in our head, all right? And that the scary movies will actually activate the alarm system in the brain, right? And it's sort of like a smoke detector in your house that goes off because there's steam coming from your shower rather than there's a fire in the house. But the fire alarm still feels the same. So it's really important to learn how to unpack and slow yourself down and be able to recognize whether this is a real alarm requiring particularly urgent medical intervention or a visit to the doctor versus a false alarm that if you just wait, it will subside on its own. Now, there was a great question here, which is that how do I talk to my medical doctor in a way that they take my concerns seriously, right? And that they don't sort of dismiss me as quote, a hypochondriac. And I think one of the things that's enormously helpful is to ask your doctor to help you come up with a list of symptoms that you can refer to, particularly when you're in the midst of feeling scared or anxious or panicky, to know whether or not this is something that you need to act on. And doctors who work in an emergency room have a list. Here's a list of the kinds of things they look for about whether or not it's a medical emergency. So I encourage you all to work with your doctors to make your own list that you can refer to. All right. So when the alarm bell goes off, can you tell whether this is a false alarm or a real alarm? All right. Let me talk about worry and then worry a little bit and then a couple other things and then I'll stop. All right. Now, when I treat anxiety disorders, I almost never talk about learning how to relax. Right? I mean, there's no question that that it can be useful to learn how to regulate your breathing or learn how to relax your muscles or do visualization to reduce anxiety or do stress management, all of that. I'm not saying that that's not helpful, but what really drives anxiety disorders, particularly health anxiety, generalized anxiety disorder, is worry. And this is really where I focus my treatment, and where many of us in the field who specialize focus in this process of worry. Some of you will recognize Alfred E. Neumann from Mad Magazine, right? And in general, when people are worrying, when we worry, there are two thinking errors. We tend to overestimate the probability or risk of a bad event occurring. In fact, studies show that 85% of what we worry about never happens. And then the other thing is that we then underestimate our ability to cope, that most of the time, even if the bad thing occurs, we cope with it better than we than we think we are. Where I find that I get the most bang for my buck is to actually look at the process of worry itself, right? And I will tell you that therapists who don't specialize in anxiety disorders often don't know about this kind of work. To actually, rather than going for the content of the worry, it's the process that people go when they worry. Let me take you through an exercise, a really quick exercise, all right, to sort of demonstrate this. All right, what I want you to do is I want you to just think of a worry that you have. And it does not even have to be about sarcoidosis. It can be about anything, all right? Okay. Now, when I say go, I want you to worry on purpose for 30 seconds. All right? Ready? Go. All right, come back. Are you back? The only people I can see are Sean and Abigail. Are you guys back? Okay. Now, I want you to notice something. Notice when I said come back, you knew exactly what I meant, right? Right? You were off in worry land, and you would intuitively noticed how to come back. And how'd you come back? You came back to me to connect with me, right? In fact, you even made eye contact with me, right? It's like everybody intuitively knows how to do this. Well, isn't this interesting? Right? That actually worry is something you can control and stop, right? At least with, in this demonstration. So I want you to do it one more time, and I want you to notice what you do. And I have never done this exercise where people don't do this. When I say go, there's actually something that you physically do when you go into worry. Ready? Go. There it is. What'd you do? What you did is that you broke eye contact, and you either looked up, looked down, closed your eyes, or whatever. And what you do is, what we do when we worry is that we break contact with the present moment, connected to the present moment through our senses, what we can see, hear, smell, taste, and touch, and we go up into our imagination and time travel. Actually, neurophysiologists have actually identified the time traveling circuitry in the brain, and we time travel and we go into this bubble of our imagination, right? And it's like we're gone. It's a different place. Now I want you to do this one more time, and I want you to try this. Stare at my nose. All right, now worry. It's a lot harder, isn't it? Right? Okay, now that doesn't mean that my nose has magic anti-worry properties. What it does say is that if we stay connected to the present moment through our senses, to the task at hand, to what's going on, to what's actually happening, right? This gives us an anchor that helps us either stay out of our imagination or come back from our imagination when we notice that we're gone. And this is what we mean by addressing the process of worry rather than the content of worry. So worry has two components. Virtually all worry has two components. It begins with a question. It's almost invariably what if, or maybe, or could be. What if some catastrophe or poor outcome, right? And so it's almost always future oriented. It's usually based on some trigger in the here and now. Often the case of health anxiety, it's a physical sensation. And let me say that a physical sensation is not the same thing as a symptom, right? Right? a physical sensation like a tightness in your chest or a pain in your head, that's a sensation. A symptom is when you add a story to it, and the story may or may not be accurate. Right? So it almost always involves imagining and simulating some possible event, usually in the future. The other component of worry is the attempt to answer the what if question. It's repetitive. It involves what it does is when we engage with the what if question, it keeps us immersed in the imagined story. And then what happens is when we get immersed in the story, like watching a scary movie, Texas Chainsaw Massacre 13, when you're absorbed in the story, your fear center will be triggered as if it's actually occurring. So, when do we try to answer the what if question, right? Sometimes it's useful, but you must be able to answer the following two questions with a yes, or it must fit the following two criteria: that it's a solvable problem in the here and now, namely we have enough information to do something about it, right? To figure out a problem, and there's something that we can do about it in the here and now. All right. If not, our job is to recognize the what if question and not answer it. What I've come to understand is that worry is best understood as a habit, right? And that it is a habit that seems to be both useful and uncontrollable, and that we tend to engage in this habit in the presence of uncertainty. I'm not going to get too much in this, is that actually it's useful to sort of ask yourself, when you notice that you are worrying a lot, time traveling, trying to figure out or predict or make sure that this feared event doesn't occur, that there's actually part of us that at least that believes that there's something valuable about it, right? It can be a kind of rehearsal. It can be keep me from getting blindsided, that somehow I'll find an answer if I ruminate about this. That actually, if I don't worry about it, somehow I'm being irresponsible or careless, or that I don't care. So how do we break the worry habit? It's important to examine your beliefs about worry as being either something you can't control or something that's valuable. Learning how to catch the what ifs as if they arise, and you actually practice refusing to answer the question. It's kind of like during a Zoom session when there's an incoming phone call, and you just decline to answer the question. And if you keep declining to answer the question, eventually the person stops calling. And the mind tends to work that way. And then what do we do when we refuse to answer the question? Like in that exercise, we return our attention back to the present moment, to the task at hand. Two of my favorite quotes is Dan Zadro: "Worry is the misuse of the imagination," and Eckhart Tolle: "Worry pretends to be necessary." Here are a couple of books that I can recommend. Here, my favorite book on worry is by my friend and colleague Dave Carbonell, The Worry Trick. And then here's one on health anxiety by Karen Cassidy. I highly recommend both of these. Let me also mention that what can be useful is learning mindfulness, which is really basically learning how to train your attention. And particularly, you might explore something called MBSR, mindfulness-based stress reduction, which was actually developed back in the 80s by John Kabat-Zinn in a hospital setting to deal with patients with chronic and sometimes life-threatening illness. And my hunch is that Kabat-Zinn probably had at least one person with sarcoidosis in some of his original groups. All right. here's something that maybe if we have time, I can come back to. And here are ways of contacting me. So, wow. So I'll stop there. Questions, comments?
Oh, that was wonderful. Really, really good. You know, one question that came in, talked a little bit about, you know, what were the best ways to handle anxiety without prescription medication?
Yeah, and I think that the answer is cognitive behavior therapy, right? And particularly from somebody who not only specializes in CBT, but if you can, specializes in anxiety disorders. I'm not trying to, sell my book, but we I'm part of a large group of a special anxiety disorder practice, and there are, and there are others in the area. Oftentimes they're affiliated with university systems. So yeah, so I would say really, really working on patterns of thinking and behaving, because again, so much anxiety, right, is the result of worry, right? And if you can learn how to catch yourself in the worry habit, it can make a huge difference in terms of your anxiety level. Likewise, for panic attacks, there's very specific treatment for panic attacks. It's somewhat different than the treatment for worry, but the cognitive behavioral treatment, which is basically learning how to not be afraid of physical symptoms. So that's my, oh, and by the way, there was also a question about insomnia, right? As it turns out, the best treatment for insomnia is, there's a very specific treatment for it. It's called cognitive behavior therapy for insomnia. And it is an evidence-based protocol that can be very, very effective, which isn't say that that there can't be a role for medication if you're having trouble with sleep. But really the treatment of choice is CBTI, it's called. And I know that there are some, that Johns Hopkins actually has some behavioral sleep medicine professionals.
Carl, how about, one question came in, someone said that they had anxiety. They felt as though they had anxiety before they got diagnosed with sarcoidosis. Yeah. The question would be, is that also a trait?
Is that also a trait? That I don't know that there's any evidence that having anxiety makes you more susceptible to sarcoidosis. I mean, like I said at the beginning, we don't really know what causes sarcoid, and I doubt that it's an underlying anxiety disorder, because I got to tell you, given what I do for a living, I would see a lot more sarcoidosis. But I will tell you that it does, I think I mentioned that having a pre-existing anxiety disorder can make it more difficult for you to cope with dealing with a serious illness like sarcoid, right? And then I think also that there's evidence that if you have anxiety and depression with sarcoid, whether or not you had pre-existing mood or anxiety problems, treating that improves long-term outcome, right? Mm-hmm. All right. I do want to say one thing. There's a lot of BS about stress, that somehow stress is harmful, right? That I even heard sometimes you just say stress kills. Well, guess what, right? Everybody experiences stress. And one of the things that sort of has an impact on whether or not stress is harmful is whether or not you see stress as dangerous, rather than, oh, this is a challenge that I need to address. So it's really your attitude towards stress more than it is the stress itself that determines the effect on you. One of my personal missions is this idea that, we have to get rid of stress or it's going to kill us or harm us or make us sick or whatever. It's a lot more complicated than that. Okay.
Mhm. Great comments. Yeah, totally agree. Okay, next question is, how do you feel about antidepressant medication?
Yes. So the evidence is that for anxiety disorders and depression, antidepressant medication, particularly the newer medications like the Prozac type drugs, Prozac and Zoloft. Again, I'm not an MD, I'm just citing what the research says. I'm not making any treatment recommendations. I'm not a physician, but the evidence shows that antidepressant medications can be very helpful for anxiety and depression. Also therapy, particularly cognitive behavioral therapy, can also be effective. And whether or not the combination of the two gives you an even better result, there's some question about that. But certainly I know lots of people that have, that are on both medication and see me for therapy or see my colleagues for therapy. Personally, I've been on antidepressant medication for my anxiety in my past, So, one way that I conceptualize medication, particularly the antidepressants, is that it's a form of support, right? And particularly during a rough time, and it can, and the antidepressants, the antidepressants do more than treat depression. They can really also help with stuck thinking. They can really make the thinking less sticky and make it easier to get out of these thought loops that we tend to get into when we are worrying.
This is a question related to that, and maybe you just answered a little bit, but the next question is, how does one tell if anxiety is due to sarcoidosis or just life? And is there a distinction?
Well, that's an interesting question. Certainly, certainly one of the things that one of the organs that sarcoid can affect is the brain, right? So I don't know of any research to show how inflammation in the brain can affect mood and anxiety, but it certainly makes sense, right? Actually, there has been research about the role of inflammation, particularly in a depression in recent years. So there's that potential cause and effect. But I think, though, that that it is not necessarily inevitable that even when you get a serious diagnosis, that you have to experience a high level of anxiety. It's really interesting. I got a biopsy from my dermatologist. They took something off my arm, and they called me with results and said it was benign. And they said, it's nothing to worry about. Right. And it's almost like embedded in our culture that if you are sick, worry is inevitable. Right.
Yeah.
And actually it's not. Right. Yes. Does everybody worry? Yes. But when worry escalates to a pathological level where it's wearing you down, it is treatable. Right. So So, one of the things that we talk about in cognitive behavioral therapy is that there's the activating event, and then there are the feelings of fear, right? But what mediates in between the activating event and the feelings of fear and panic and anxiety is the way that we're thinking, right? And that if we target the way that this is the sort of fundamental, somewhat simplified model of what CBT is, we're going to look at the underlying beliefs and thoughts that turn the activating event into a scary and unnecessarily scary experience, or excessively scary experience.
Mm.
So then the question is it sarcoidosis that causes it, or is it the way that we relate to having that information that causes the anxiety?
Yeah. Yeah. Do you think Prozac is good for worrying?
Well, Prozac is one of the antidepressants, and certainly Prozac has been used. Prozac and the drugs like that can be useful for many of the anxiety disorders, including with generalized anxiety disorder, which is really, actually, they thought about changing the name of generalized anxiety to generalized worry disorder. And I got to tell you, I would endorse that. I think it would be so much more helpful. Is that you fundamentally have a worry problem.
Yeah.
Right. And medication can certainly help with that, in my experience.
You're right.
Yeah, and that the data shows that.
Yeah. Can your anxiety cause panic attacks?
Okay. All right. A panic attack is not an out of the blue, sudden, unexplainable experience where you suddenly feel filled with terror, right? That is a common misconception. What is a panic attack? A panic attack is virtually always that anxiety shows up, anxiety sensations, feelings show up, and then there's a secondary reaction to that, and you become afraid of how you're feeling. And I think I mentioned this in terms of the vicious cycle that people get into dyspnea. A panic attack in general is this self-amplifying loop between feeling anxious and being afraid of feeling anxious, right? And the standard of treatment, as it turns out, is learning how to develop a different relationship with being anxious. All right, and to learn that this is discomfort and not danger. That actually reducing the fear of fear, right? Remember what FDR said? We have nothing to fear but fear itself. Mm-hmm. Reducing the fear of fear is much more important than reducing the anxiety level. I'll give you an example. Before I signed on here, I noticed that I was probably on an 8 out of 10. Right. And the answer is, and the question is, what did I do? I get very nervous, particularly, I'm speaking to a fairly large audience and I can't see anybody, right? And so the question is, what did I do? And the answer is nothing. I let myself feel anxious and I focused on the task at hand. What I didn't do was, oh my God, what if I have a panic attack and freak out and ruin the seminar and disappoint Sean and, forever humiliated because I could have easily gone into the story. And, 50 years ago, I used to go into those stories. Now I don't anymore. Mm. Because fundamentally what's changed is my relationship with my anxiety. That it's just a normal part of being human, and that anxiety and even panic is never, ever psychologically or physically dangerous. And the best thing to do is nothing, to wait for it to pass.
Mm. Yeah.
Which is one of the reasons why actually I don't teach relaxation or breathing retraining or in general, because it sends the message that you have to control this. Actually, you don't. That your body will fix itself if you get out of the way and stop adding on, putting kerosene on the fire.
Right. Yeah.
Does that make sense?
It does. It does. I like it. I could use that. Are there any natural supplements that you would recommend for anxiety?
You know, I got to tell you that I have not been impressed, you know, and sometimes you hear people talk about Kava or St. John's Wort or whatever. Yeah. And I have seen some of my patients try it. Some people talk about tryptophan, and I've never seen it be particularly helpful. Of course, placebo is always powerful. So, is it the herb or is it the placebo? I don't think that we have much evidence that says that the natural supplements really confer any benefit over placebo, but which is unlike with some of the medications, right? My biggest concern is when people, a lot of people with anxiety are afraid of medication because it's quote unnatural, right? And so when they could benefit from it, so really seeking natural supplements is often an indication that they are almost phobic of medication, which is sad, because a lot of times people can really benefit from it. And one of the great myths is because it's natural, it's safe, right? Well, some of the most toxic substances known to man are natural, right? So there's all kinds of BS about living the, taking organic stuff. Now, naturopaths are probably going to want to string me up, but particularly when it comes to psychiatric medication. By the way, when I did try, when I had sarcoid, I did see a Chinese herbologist. I saw an acupuncturist. I did complementary medicine, but I didn't do it instead of, seeing a pulmonologist and being on prednisone and getting Western medicine. I did it as complementary medicine. Did it make a difference? I don't know. Wasn't a scientific experiment. I'm just grateful to have been in remission for 18 years.
Yeah. So, Carl, in closing, could you leave us with some words of wisdom that can lead us? We come together, we look for information, data, that we get to ask questions. Could you give us a little bit more about some positive ways we could take steps and really own this destiny that we're trying to navigate, things that we can do to self-advocate for ourselves, especially in this area of trying to deal with anxiety?
Yeah, that's a great question. Well, the first thing is that there's a tendency when you have a serious medical illness to focus almost exclusively on that, right? And so the first step is to take your mental health seriously, right? And like I say, there's some data that suggests that if we attend to our mental health, that long-term outcome is improved, right? And so, but I think that one of the barriers, and less so now than it used to be, but one of the barriers is shame. That it's one thing to say, hey, doc, I can't breathe, I'm having trouble breathing, right? Or my heart is going crazy, versus, hey, doc, I'm worrying all the time, or I'm having panic attacks, or I can't get this sort of vision of dying a horrible, suffocating, death, so I think part of it is being able to give yourself permission to be able to sort of ask for help, and to be aware of the shame that sort of keeps that side of the challenge of facing sarcoid, right? And reach out for help. And let me tell you that, let me close by saying this. There was a study that was done on why people see complementary medicine providers. And what the study showed is that it has nothing to do with herbs and supplements. What it has to do with is finding a provider that takes time and slows down enough to really listen to you and listen to all of your concerns, right? And is not sort of dismissive, and is not, takes your anxiety as sort of, oh, you're just a hypochondriac, but actually helps you sort of sort out what's a real alarm from a false alarm, can make the referral to a mental health provider if possible, right? And so it's really, finding providers that you can build a relationship with, right? Not somebody that's just a technician that's going to prescribe meds or do procedures.
Yeah.
Does that help?
It does. It does. Carl, I really appreciate your time spending with us on this very important topic. I think it resonated with quite a few people that attended live. They thanked you for your insight and the information that you shared, and you got some really nice fans out there because they think the world of you, and they know the topic and everything. So they wanted us to say thank you. They really benefited from you sharing this evening and everything, and really on behalf of the Life and Breath Foundation, we really thank you for making an important step, important contribution to the foundation and to the mission of the foundation. So again, bottom of my heart, we really appreciate all that you do.